We will learn about joints under these following headings. First, we will see the classification of the joint. Then, we will talk in detail about the fibrous joints, its types, and then examples. Then, cartilaginous joints and synovial joints. So, let's begin with trying to understand the classification of joints. What exactly is a joint? Joint is the junction or articulation between two bones, which allows either growth or movement. So basically, the point or the junction where two bones meet or articulate is referred to as joint. And joints, remember, can permit for growth and also for movement. How do we classify joints? There are a number of ways by which we can classify joints. First, let's try to understand the functional classification of the joints. So, how do we classify the joints functionally? Right? Remember, functionally we have three types. What are these? These are referred to as synorthrosis. Right? Then we have amphiorthrosis, amphiorthrosis, and then finally we have diarthrosis. Diarthrosis. In synorthrosis, no movement occurs. So remember this, no movement occurs here, right? Whereas in case of amphiorthrosis, slight movement is possible, right? Slight movement is possible. And in case of diarthrosis, right, these are freely movable. These are freely movable joints. Right? This is the functional classification. What about the structural classification then? So let's write the structural classification. Structurally, the joints can be classified as fibrous joints, right? Fibrous joints. Then cartilaginous joints, and then the third type is synovial joints. How exactly do we group the joints as fibrous, cartilaginous or synovial? It is depending on the amount or the type of material that is present or that is connecting two bones. For example, in fibrous joint, we have the fibrous connective tissue that connects two bones. In case of cartilaginous joint, cartilage is present between two articulating bones. Whereas in synovial joint, the two articulating surfaces are separated by a free fluid filled synovial cavity. So based on the type of tissue that is present between the two articulating bones, we classify the joint structurally as what? Fibrous, then cartilaginous, and then synovial. Strictly speaking, fibrous joints can be synonym with synorthrosis because hardly any movement occurs at fibrous joints. Then, cartilaginous joints allow for slight movement and they can be homologous or they can be synonymous with amphiorthrosis. Then, when we talk about diarthrosis, they are freely movable and they are compared to the synovial joints structurally. Right? So, this is how we classify the joints based on their structure and function. Let's see about the types of each of these joints and what are the locations in the body where they are found. Now first, let's talk about fibrous joint. As I told you, fibrous joints are examples for what type of joints functionally? They are examples for synorthrosis. Right? So they are example for synorthrosis. The fibrous joints are further grouped into three types. Now what are they? The first one is sutures. Then the second type is known as syndesmosis. Right? The second type is syndesmosis. And the third type is referred to as gomphosis. So we have three subtypes of fibrous joints. As I said, here in fibrous joints, the articulating surfaces are united or separated by fibrous connective tissue. Right? So what about sutures? Now, as we have learned, sutures are best seen in, yes, sutures are best seen in the skull region. The sutures of the skull are further subdivided. These are further subdivided into plain sutures, right? Plain sutures, and then we have serrate suture. Then we have denticulate suture. So we have denticulate suture. Then we have squamous suture. And then finally we have the last type, which is a peculiar type. This is known as shindylisis. Right? Plain suture are typically found between the palatine bones. Right? The interpalatine or intermaxillary sutures are best examples for plain sutures. Now, what are the examples for these different types of sutures? The plain suture is found in the hard palate between the palatine process of the maxilla. Right? What about serrate suture? Serrate suture is found in the sagittal suture or the coronal suture. Right? Whereas the denticulate suture is typically found in the lambdoid suture. Right? The squamous suture is found between the parietal bone and the temporal bone. Now, this squamous suture is important in a factor during labor referred to as molding. Now, in molding, there is overlapping of the cranial bones forming the cranial vault. And this molding occurs at the squamous sutures, which is formed mainly between the temporal bone and the parietal bone. Right? So, this is regarding the squamous suture. The last one is shindylisis. Now, this is very often asked in your entrance exam. What is shindylisis and where exactly it is found? Remember, this is found between the vomer and the rostrum of the sphenoid. Remember, vomer forms the bone separating the posterior nasal apertures, right? It forms one of the important bone of the nasal septum, right? So, the end of vomer articulates with the rostrum of the sphenoid, giving rise to this special joint. So remember the examples for each of the subtype of the sutures, and each of the subtypes could be an MCQ, right? So this is regarding the sutures. Then what about syndesmosis? Syndesmosis is a special type of fibrous joint where two bones are interconnected by interosseous membrane or ligaments, right? So such joints are referred to as syndesmosis. The best example, as we can see here, this is the middle radioulnar joint. Middle radioulnar joint. Apart from this, the middle tibiofibular joint. So middle tibiofibular joint and also inferior tibiofibular joint. Tibiofibular joint. All these are examples for syndesmosis, where two bones are united by interosseous membrane, and because they are firmly united, hardly any movement occurs. Right. What about gomphosis? Gomphosis is quite simple. This is the tooth present in its socket. So, tooth in its socket represents gomphosis. The tooth is connected to the socket by ligaments, and those ligaments are called as periodontal ligaments. Right? So this is regarding the three types of fibrous joints and also the subtypes of sutures. So remember, in fibrous joints, you need to remember what are the types and subtypes and what are the locations in which these are found, and each one of this could be an MCQ. So you cannot ignore this. Right. Once we have learned about the fibrous joints, let's learn about cartilaginous joints. So the second type of joint that we learned was cartilaginous joints, and then these cartilaginous joints can be further grouped into synchondrosis. So they are grouped into synchondrosis and symphysis, which are otherwise referred to as primary cartilaginous joint and secondary cartilaginous joints. Now, what exactly are primary cartilaginous joints? Primary cartilaginous joints are those in which the two articulating surfaces are separated by a piece of hyaline cartilage. Whenever two bones are interconnected by fibrocartilage, you refer it to as symphysis or secondary cartilaginous joint. So remember, in synchondrosis, what is the uniting cartilage? Remember, it is always the hyaline cartilage. So hyaline cartilage unites two bony structures. Whereas here in symphysis, what is it? It is the fibrocartilage. Right. Now, where exactly do we find the synchondrosis? Remember, the joint between the epiphysis and the diaphysis, right? So, the joint between the epiphysis and the diaphysis is the best example for synchondrosis. Fine. So, all long bones which have diaphysis and epiphysis will have synchondrosis. Remember, in the beginning, I told the joints are the area or the junctions where two bones meet, where either growth occurs or movement occurs. So, synchondrosis is one joint that favors growth. Right. What about the symphysis and where exactly it is located then? The symphysis or secondary cartilaginous joint are the areas where the two bones are connected by fibrocartilage. And these joints are typically found in midline. Now, what joints are found in midline? Remember, the first and the most important joint you should think of is the intervertebral joints. So, we have intervertebral joints. The vertebral bodies are connected by a piece of fibrocartilage, intervertebral disc. That is the best example for symphysis. Then, it is present in or between the manubrium and the body of the sternum, manubriosternal joint. Then, it is present between the xiphoid process and the body of the sternum, xiphisternal joint. Then, it is present in pubic symphysis, right? So, pubic symphysis. Apart from these four joints, even some authors include the two halves of the mandible uniting as an example for secondary cartilaginous joint. But why exactly it is not secondary cartilaginous joint? Because this secondary cartilaginous joint is replaced by synostosis. What is synostosis? Where the joint is replaced by bony tissue. That is why the synostosis or symphysis between the two mandibular halves is never considered as a secondary cartilaginous joint. Right? So, these are some of the examples for secondary cartilaginous joint, and remember, secondary cartilaginous joints are typically found in midline. Now, in previous year questions in NEET as well as INICET exams, image-based questions have been asked on pubic symphysis and other types of cartilaginous joints. Right? So, please remember the different types for the primary cartilaginous joint as well as the secondary cartilaginous joints. Remember, there is often a confusion between one of the joint in the thorax, whether it is synchondrosis or what type of joint it is. Right? So, remember the first costosternal joint. The first costosternal joint is often considered to be the synchondrosis, which is not true. The first costosternal or first chondrosternal joint is an example for synarthrosis. Right? It is not synchondrosis, but it is synarthrosis. Whereas rest of the costosternal or chondrosternal joint are examples for synovial joints. Right? So this is regarding cartilaginous joint. Right. Once we have learned this, let's focus on the synovial joints. Right? Remember, synovial joints are the most common joints present in the body. These are the examples for most common joints. Remember, the human body has close to 206 bones. Even though there are only 206 bones, remember, there are more than 350 to 360 joints present in the body, and most of these are the synovial joints. The synovial joints can be classified based on two features. One is based on the shape of articular surfaces, and one is based on the axis of movement. Now, synovial joint classification based on the shape, we will discuss first. So, the first type of joint we have here, this is referred to as the pivot joint. Now, what exactly is a pivot joint? Remember, pivot joint is when when you have a ring of bone and you have a bone present inside which freely rotates, right? So that is a typical example for pivot joint. Now, where exactly do we find pivot joint? So the examples for pivot joints are the median atlanto-axial joint. Median atlanto-axial joint. Right? Remember, this joint is also referred to as the joint of no. Because whenever you rotate your head, right, as in saying no to anything, the joint movement occurs at median atlanto-axial joint, which is a typical example for pivot joint. Apart from this, the other examples we can think of is the superior radio-ulnar joint. Superior radio-ulnar joint and also the inferior radio-ulnar joint. So, inferior radio-ulnar joint. All these are examples for the pivot type of joint. Right. Then, the second type of joint we have is the hinge joint. So, second type of joint we have is the hinge joint. Now, what exactly is a hinge joint? Remember or compare the door to the hinge to which it is attached. Right? You can move it in only one direction. Right? So, hinge joints are such joints and they can be compared to the hinge of a door. Right? Now, what are the examples for hinge joint? Remember, the best example for hinge joint are, the first one is the elbow joint, right? Apart from elbow joint, you can think of knee joint. Now remember, knee joint is slightly peculiar. We will discuss about it. Apart from this, you can also mention interphalangeal joints. Interphalangeal joints that are formed between different phalanges are typical examples for hinge joint. Right? Now, what about the knee joint? Right? Is knee joint a typical hinge joint? Remember, knee joint is often described as a modified hinge joint. Right? It is described as a modified hinge joint. Why? Because usually at hinge joints, only two movements can occur. What are they? Either flexion or extension. Right? Whereas at knee joint, even slight degree of internal and external rotation occurs. So if a hinge joint allows for rotation movements to occur, you call it as modified hinge joint, or in other terms, you refer this to as the condylar joint. Right? So knee joint is often described by many authors as condylar joint. Apart from the knee joint, even the temporomandibular joint, the TMJ, can be an example for condylar joint or bicondylar joint. Right. Now this is regarding the second type, that is hinge joint. Now what about the third type? The third type of joint we have here, this is the saddle joint. Right? So this is saddle joint. Now what exactly is a saddle joint? Remember, the saddle joint can be compared to the saddle of a horse. Right? A saddle is something that you put on a horse back before you sit. Right? So why saddle joint is called so? Because these joints have a concave and a convex surface on a single articular surface. So a single articular surface will have both concave as well as convex surfaces. Right? So such joints are called as saddle joints. Now what are the example for saddle joint? Remember, the best example for saddle joint is the first carpo-metacarpal joint. First carpo-metacarpal joint. Then you have the sternoclavicular joint. Sternoclavicular joint. These are the best examples for saddle joint. Right? Fine. Then the fourth type of joint we have, what is this joint? This is referred to as the plane synovial joint. Now what exactly is a plane synovial joint? When the two articular surfaces are flat, you call it as plane synovial joint. Now what is the best example for plane synovial joint? Remember, the plane synovial joints are best seen between carpal bones or tarsal bones. So intercarpal joints, intercarpal joints or intertarsal joints. So joints between carpal bones or joints between tarsal bones. Then intermetatarsal, intermetatarsal or intermetacarpal. Intermetacarpal. So in between the metacarpals or in between the metatarsals, you have joints. And such joints are referred to as intermetatarsal or intermetacarpal joints. These are best examples for the plane synovial joints. Right? Fine. Now, apart from this, what are the other types of joints? The next type of joint we have is a condylar joint. Now, this is also referred to as the ellipsoid joint. Now here, one articular surface is convex and the other articular surface is concave. So they are reciprocally curved. Such joints are referred to as ellipsoid joints. Right? What is the best example for ellipsoid joint? Remember, the best example for ellipsoid joint is the wrist joint. Apart from wrist joint, are there any other examples for ellipsoid joint? Remember, the atlanto-occipital joint. The atlanto-occipital joint. Remember, the atlanto-occipital joint is responsible for the movement of nodding, right? So that is why these are also referred to as the joint or joints of yes. The joints of no is formed by what? The median atlanto-axial joint, whereas the joints of yes is formed by the atlanto-occipital joint. Apart from this, you can also include the metacarpophalangeal joint, the MCP joint, metacarpophalangeal joint or metatarsophalangeal joint. All these are examples for ellipsoid joint. Right. Then what about the sixth type? The sixth type is referred to as ball and socket type. So this is the ball and socket type of joint, where you have an articular head which is spherical, which fits in a cup-shaped depression. Right? So such joints are called as ball and socket type of joint. So what are the examples? The best example is the shoulder joint. Right? Shoulder joint. Then we have the hip joint. Now these are very commonly known joints, right? There are two more joints which are considered as examples for ball and socket type of joints. Now what are these? Remember, the third type is incudostapedial joint. Incudostapedial joint, right? The fourth one is talocalcaneo-navicular. Talocalcaneo-navicular joint, right? So shoulder joint and hip joint everybody will remember, but try to remember the other two examples. Incudostapedial joint, which is found between the incus and the smallest bone in the body, that is the stapes, whereas the talocalcaneo-navicular joint present in foot is also an example for ball and socket type of joint. The joint between the incus and the malleus is actually an example for saddle joint. So that also you can remember, the incudo-malleolar joint. So incudo-malleolar joint is an example for saddle type of joint. Right? So this is regarding the detailed classification of joints. Right? So for each type of synovial joint, you must know the examples. They will give a name of a particular joint and they will ask you to identify which type of joint it is. For example, they'll give you a median atlanto-axial joint and they will ask you which of the following type of joint is the median atlanto-axial joint. So you have to identify the type. Or they will give the name of the joint and they will ask you which type of joint or which of the following joint is, let's say, a ball and socket joint. Which of the following joint is a ellipsoid joint or a saddle joint. So both types question can be framed. Right? Fine. Now this is about the detailed classification of synovial joints according to shape. Now how exactly do we classify synovial joints? Based on the axis of movement. Right? Based on the axis of movement. Based on the axis of movement, we have three types of joints. What are they? These are uniaxial, right? Then we have biaxial, right? And the third one we have as multiaxial. Uniaxial, biaxial and multiaxial. What exactly are these? Uniaxial joints are the joints where movement occurs along a single vertical axis or a transverse axis. Right? Examples for such joints include pivot joint, right? Or hinge joint. Pivot joint or hinge joint. Biaxial joints are the joints where the movement can occur in two axes, two different axes. Right? Example for biaxial joints are, what are the other joints left? So we have the saddle joint and then we have the ellipsoid joint. What about condylar joint? Remember, condylar joints are examples for modified hinge joint and they also can be included as biaxial joints. What about multiaxial joints? Multiaxial joints, as the name suggests, movement can occur in multiple axes. Right? So what is the example for this? Remember, the best example for this is the ball and socket type of joint. So ball and socket type of joints are best examples for the multiaxial synovial joints. Right? So this is regarding classification of the synovial joints based on the axis of the movement. The examples will remain the same for pivot joint, hinge joint, saddle joint or ball and socket. Right? So what you need to know in detail, know the classification of synovial joints according to shape and know examples for each type. And then know which type of synovial joints are uniaxial, biaxial and multiaxial. This is regarding classification of synovial joints based on the axis of movement. Right. Once we have learned the details of joints, let's try to summarize now. As we learned, joints can be broadly grouped into what type of joints? We have fibrous joints, right? Then we have cartilaginous joints, right? Cartilaginous joints, and then we have synovial joints. Right? The fibrous joints can be further grouped into three. What are they? They are sutures, then we have syndesmoses, and then we have gomphoses. Whereas cartilaginous joints are broadly grouped into primary and secondary. Whereas we have 6 major types of synovial joints. What are they? We have the pivot joint, we have the hinge joint, then we have the ellipsoid joint, then we have the saddle joint, then we have the plain synovial joint, and then finally we have the ball and socket type. Examples for sutures found in skull. Syndesmoses, the radioulnar joints, the middle radioulnar and the middle tibiofibular joints. Gomphoses, tooth in socket. Primary cartilaginous joint are synchondroses, which are present in all growing bones. Right? Secondary cartilaginous joint is present usually in midline, starting from venobriosternal, xiphisternal, pubic symphysis, then intervertebral joints connected by intervertebral discs. Then, in synovial joints, the best example for pivot joint is the median atlantoaxial joint and the superior and inferior radioulnar joint, hinge joint, elbow, knee and interphalangeal, ellipsoid joint, the wrist joint and the atlanto-occipital joint, saddle joint. The best examples include the first carpometacarpal joint and then sternoclavicular joint and also metacarpophalangeal joint. Plain synovial joints are found between the tarsal bones and the carpal bones or between the metacarpal bones and the metatarsal bones. So intercarpal, intertarsal, intermetatarsal and intermetacarpal joints all are example for plain synovial joints. And then ball and socket type of joint is found in the shoulder joint, hip joint, incudostapedial joint, and talocalcaneonavicular joint. Right? This